chronic pancreatitis. Today we will discuss a rare condition called chronic pancreatitis. So what is chronic pancreatitis? What are the symptoms of this problem? What are the complications if we do not treat it? And what are the treatment options available for the treatment of this condition? As the name implies, chronic pancreatitis. Chronic means long-standing. Pancreatitis means an inflammation of the pancreas, a swelling of the pancreas. So this is a condition where, because of various reasons, the pancreas, which is an important organ situated in the abdomen, which has got important functions like secretion of insulin, secretion of many digestive enzymes, this pancreas gets inflamed and causes many problems to the patient. So why does this happen? There are many causes why chronic pancreatitis happens. Some of the common causes being excessive alcohol intake. Patients can have hereditary problem which can cause some genetic defects whereby the pancreas gets inflamed. Diet related, and sometimes we do not know the reason for this pancreatitis, where we call idiopathic chronic pancreatitis. In this condition, the pancreatic duct, which is a tube which is situated inside the pancreas, through which the pancreatic secretions drain out, becomes narrowed at multiple points. And there are also stones which develop inside the pancreas which block the duct further. What are the symptoms which chronic pancreatitis causes? The most common symptom because of which patients come to the doctor is pain. Patients can experience severe repeated attacks of abdominal pain, and it can affect their lifestyle. They might be required to go to the hospital repeatedly to get painkiller medications. The second common problem is diabetes, because the pancreas is the most important organ which secretes insulin. When that organ is affected by chronic pancreatitis, it can cause diabetes. Patients can also have problems in digestion, wherein the proteins and fat do not get absorbed into the intestines, and they can have loose stools and weight loss. How do we diagnose chronic pancreatitis? The diagnosis of chronic pancreatitis is usually done by means of a CT scan or an MRCP scan, which can show the damage to the duct and the presence of stones. What is the treatment for chronic pancreatitis? Majority of patients can be treated with medicines which decrease the pancreatic secretion, thereby decreasing the pressure in the pancreas and relieve the pain. In patients who have very large stones, treatment can be done through endoscopic methods, whereby the endoscope is used to blast these stones, make them into powder and make them pass out. In severe cases, medicines and endoscopy do not work, and if the patient has severe pain and other complications of pancreatitis, he will need a surgery, wherein through a surgical method the entire pancreatic duct is opened out, all the narrowed parts are dilated, and a separate bypass is created between the pancreas and the small intestine, through which the pancreatic secretions can drain out easily into the intestines. If chronic pancreatitis is left undetected and untreated, in the long run it can lead to development of pancreatic cancer. It can lead to development of pseudocysts, which are fluid collections in the abdomen. It can cause dangerous complications like rupture of the nearby vessels of the pancreas, causing massive bleeding. So in patients who have long-standing abdominal pain or diabetes of unknown cause, it is important to check for the presence of chronic pancreatitis.